Dr. Khan. I'm a gastroenterologist at Houston Northwest Medical Center Hospital, and today we are going to talk about colorectal cancer or colon cancer, which involve the large intestine and the rectum. If it is detected early, even if it's spread to nearby lymph nodes, the surgical treatment followed by the chemotherapy and radiation is a quite effective mode of treatment. However, if it's spread to the distant organs like a lung or liver, then the treatment may not be that effective. Exact cause of colorectal cancer is not known. However, there are certain risk factors which should be considered, and the patient should be evaluated accordingly. People who are above the age of 50, they should be screened routinely. More than 90% of the colon cancer is found in people who are above the age of 50. People who have got history of colon polyp, they should also be screened routinely. Polyps are small growths found in the colon which should be removed routinely. Family history is also important. If next of the kin or the parents have got history of colon cancer, those people should be evaluated properly. People who have got a personal history of colon cancer, they have more chance of developing cancer second time. Women who has a history of breast cancer, endometrial cancer, they have a relatively higher chance of developing colon cancer. Then the people who have got history of ulcerative colitis, Crohn's disease, they have a relatively at the higher risk. Diet factor is important. People who eat high fat, low fiber, low calcium diet, they are more prone to develop colorectal cancer. Cigarette smoking is another risk factor. In early stages, colon cancer does not cause any symptom. That's why it's important to have a routine screening in people above the age of 50. Certain symptoms like rectal bleeding, diarrhea, constipation, narrow stools, feeling weak and tired because of the anemia and secondary to blood loss, unexplained weight loss, those are the people who have possibility of having the colon cancer, and they should have a colonoscopy for a proper evaluation. There are four different types of polyps. Polyps are the growth found in the colon and the rectum. Most commonly found polyps are the hyperplastic polyp, which most of them they are benign. The second type is pseudopolyps. These are the polyps which are found in patients who have got ulcerative colitis. These polyps are secondary to chronic inflammation. The third type is adenomatous polyp, which are most commonly found in almost 70% of the cases. Polyps are found as adenomatous polyps. And the fourth type is a glandular polyp. Those are relatively more aggressive polyps and found in about 15% of the cases. Whenever the polyps are found during the colonoscopy, most of the polyps can be very easily removed. Colorectal cancer affects all men and women and all the races. It's the third most common cause of cancer in men after the cancer of the lung and the prostate. It is also third most common cause of cancer in women after the cancer of breast and the lung. 80% of the colon cancer can be easily treated if they are detected early. However, the only difficult cases are when the cancer is already spread to the lung and the liver. Once the patient is diagnosed by colonoscopy and the biopsy process, then staging is performed. Stage varies from 1 to 4, or due classification A to D. A classification or number 1 classification is in those patients in which the cancer is involved in only the mucosa, which is the inner lining of the colon. But once the cancer starts going to the muscular layer, serosa, which is the outer lining of the colon, or towards the lymph node, then the classification changes to B and C. And once the distant organ like a liver, lung, or any other site is involved, then this classification changes to D or number 4. Treatment of colorectal cancer start from performing a colonoscopy by a gastroenterologist, taking the biopsy, sending the biopsy to pathologist, confirmation of the diagnosis by pathologist, and then staging these patients. It starts from the surgical resection, followed by radiation and chemotherapy.